I don't think profit and purpose should be considered opposites. I think they're truly a stress test for whether or not your model is actually built to last.
25 years ago, responsible business meant writing a check. Now it means rethinking how we source, how we sell, who we hire, and what we stand for, all while navigating AI, geopolitical disruptions, and scrutiny from every direction. I'm Laura Herman with Dalberg Advisors, and this is Responsible Business, a set of conversations with leaders from around the world who are doing just that. These conversations are for anyone who believes business can and should be a force for good. We hope they sharpen your thinking and your impact. It's amazing to be here with you today, Priya, and have a chance to continue the conversations we've had over the years about profit with purpose and how businesses are adapting or not to the pressures from their employees, to the pressures from their consumers and their partners, about balancing the social impact they have up and down the decisions that are made inside of any company. I'd love to start with just hearing about your role, how you think about this balance between profit and purpose and the tensions inherent in that.
Well, hello and thank you. I really appreciate the opportunity. So at MSD, or Merck as we're called in the US and Canada, we have a credo that has been passed down from our founder, George W. Merck, 100 years ago, that says medicines are for the people. It is not for the profits. The profits follow. And when we have remembered that, they've never failed to appear. So I think that's really powerful and acts as a reminder. And our relatively new CEO, Rob Davis, who now I guess is like heir and now owner of that legacy, says we have two metrics of success: how many people we help and how much help we give them. So within that context, Laura, I lead the International Health Equity and Partnerships team, working across the company to ensure that our innovations from our pipeline reach people living in low and middle income countries as deliberately and as sustainably as they reach patients in New York or London. When you talk about tension, from my perspective, I think it's less profit versus purpose. It's more short-term versus long-term. So it's the pressure of quarterly results versus the patience required to build supply chains and trust and stronger health systems, especially in low middle income countries. So in summary, I don't think profit and purpose should be considered opposites. I think they're truly a stress test for whether or not your model is actually built to last.
And this is a great point, built to last. What has to be true for you to be a company that is still thriving after 100 years? And I think you describe it beautifully, how this relationship can be self-fulfilling in creating that company that is durable over maybe centuries. Obviously, the heart of that model for biopharma is innovation, is the R&D, which is constantly creating the medicines that we depend on around the world. Tell me more about innovation and what it means to you. You described your role as being really the full life cycle of a product, but how do you think about innovation within each of those big buckets?
Laura, as you said, in our industry, so global biopharmaceutical companies, innovation is often confined to molecules, but science is only half of the breakthrough, because if you care about the impact you're having in the world, like we at MSD do, then especially for global health, the other half of the breakthrough innovation required is actually moving that medicine from the lab to the last mile. So for me, innovation is the financing mechanism that makes the invention affordable, a tech-enabled delivery model that makes it accessible, or a partnership that didn't exist before. So we've had the privilege to work on extraordinary science: oncology, cardiovascular disease, prevention against infectious diseases, the fight against HIV. But for all of those, we have to solve for the logistical and systemic challenges that prevent those reaching patients, especially in resource-constrained environments. So I think when you ask me, what does innovation actually mean for me? I think the real innovation is moving medicines from lab to Lagos, from regulatory approval to rural clinics. So it's not now just about discovering the molecule, which is absolutely critical, but it's also to build that connective tissue, the partnerships and the supply chains that allow the science to cross borders. We often say, for those of us working in emerging markets especially, innovation isn't proven at approval. It's proven at the last inch when the patient actually receives it. Of course, breakthrough science matters deeply, but as I said, and you stressed as well, that it's the innovation of reach that all of us really need to go towards, right? And I think it is hard, and we've been doing it for a while. But now I think what I'm super excited about is setting new standards for what people can and should expect from leading pharma companies like MSD. So I just wanted to say, watch this space, because I think under our CEO, Rob Davis's leadership, I think we're really showing that striving for broad access isn't charity. It's like responsible business. We need to be setting some new standards for how we do innovation for reach and not just innovation in the lab.
And I know from your work and others that the degree of creativity required to address all of those potential barriers in a way that's sustainable is massive. And I think underappreciated by people who aren't as close to it as you are and your team is. Of course, one dimension of innovation that I would be remiss to not bring up is the role of AI in addressing those barriers and others. And I'm curious, what's the biggest change you'd like to see when you think about this macro challenge of getting products to those who have never had access to even some of the most basic products, to get access to the most sophisticated things that come through the Merck pipeline?
The biggest change that we're seeing when it comes to healthcare is AI, and AI can really be powerful. Like, it's the most stated statement in the world. But I think, especially for emerging markets, we have to resist the temptation to use it to replicate the expensive and fragmented systems we have in high income countries. And we know that doesn't always lead to improved health. So I think if we simply digitize those expensive, fragmented, actually very hospital-centric models, we're going to be exporting their inefficiencies. And I want to see AI used as a leapfrog technology, like we saw around mobile banking in Africa. I was working in Kenya at the time. Kenya didn't replicate Western banking infrastructure. It moved straight to mobile money. And what I saw was that it gave women in informal settlements control over their savings. I watched how that translated into more antenatal visits and safer facility deliveries, because they could siphon off some of the money that they'd earned selling carrots into a pregnancy savings account. So I think with AI and technology, I'm really hoping our countries that we're focused on, the low and middle income countries, have the opportunity to design care models and redesign care models that are equitable, preventive, and more data-driven from the start. If you look at the innovation pipelines of many companies, including at MSD, they're accelerating. We're going to have extraordinary advances in cancer and other complex diseases. But most low and middle income countries simply don't have enough specialists to deliver on that promise. So it's becoming a human capital issue. And I think this is where AI can become really interesting. I'm a clinician myself. I'm not saying leverage AI as a replacement for clinicians, but as a force multiplier. How do we use AI to help the existing frontline providers deliver increasingly specialized care? And that's what I mean about we have to rethink how we design care systems, because what I'm really worried about is scientific progress and patient access will continue to widen if we don't do system redesign.
The leapfrogging idea, I see people floating that in some of the most mature markets where Merck and others operate, right? In areas like menopause, where even the clinicians we have are not deeply trained. And so how can you use AI to prompt about a range of conditions that a clinician might not automatically connect? So I think this idea of leapfrogging what might be historical pathways to progress could have relevance in many markets, but certainly the gaps are so profound where your team is working. You mentioned role of leadership at Merck, and you mentioned this idea of standard setting for the industry. And I'm curious if you think about leadership today with the promise of the innovation, the hopes for AI, but this risk of progress and access diverging even further. What do you think leadership requires today within the industry?
Yeah, it's a great question. I think the other thing we haven't spoken about is geopolitical complexity. We're living in turbulent times. And I think turbulence is actually the ultimate test, and we saw this during COVID. Turbulence is the ultimate test for a leader's values. So I think in an era of geopolitical fragmentation, funding volatility, as you said, rapid technological change, leadership, I really think right now requires steadiness. It really requires the humility to admit what we don't know, the courage to act with imperfect information, especially in our markets, and then the resolve to build partnerships, even when the incentives are not perfectly aligning. So I often look to history to understand what worked and what didn't. When I think about some of MSD's greatest successes, whether it's eliminating river blindness, the HIV treatment program for the AIDS crisis in Botswana, to MSD for Mothers, which I had the privilege of being the executive founding director for, none of them were headline news. They were decades-long shared commitments with multiple partners implemented over time. So I really think now, especially in global health, progress is not going to be heroic. It's going to be built through partnership. And I think the partnerships are going to be increasingly complex. And that's one of the reasons my team is called Health Equity and Partnerships. Equity is hard to scale without true partnership.
That's for sure. I think everyone recognizes these problems are too big for any one person to tackle alone, any one organization. I'd love to, maybe in closing, bring us back to something you started with, which was this long-term horizon that companies need to really think about this connection between profit and purpose as not one that is in conflict. And I'd love to hear if there were something you could change, you had a magic wand, what would it be that would encourage more companies across industries to think deeply about the social consequences of every decision they make, the chemical that goes in the product, the impact of the advertising on a child, the long-term partnerships, safety in their supply chain? What is the one thing that you think could incentivize companies to really see these as complementary and reinforcing and not as trade-offs?
It's an interesting question, right? About what motivates companies to center purpose. And when we ask that question, we're putting purpose and social consequences at odds with profit. So I think as a company, you do need to understand and then feel the benefits you gain from focusing on long-term value creation. And then I think that needs to be communicated, incentivized, and operationalized at all levels of the org. Incentives drive behavior for all of us, regardless of where we come from. So I think in a big company that's made of lots of people, it's not enough to just align incentives around long-term value creation. People need to be constantly reminded and supported as well as motivated. So when I think about what has worked at MSD, the George W. Merck quote of medicines are for the people and profits will follow, it aligns profits and purpose right from the get-go. We communicate again and again the results that come from that, whether it's reputational results, which gives us legitimacy and credibility to continue to do the work we're doing, whether it's actually the revenue that's coming from entering new markets, whether it's the openness that new partners have to work with us in new spaces. And so every single time there's a demonstrable success, we as leaders talk about it. So I think when it comes to profit and purpose, it's easy to say, well, is it one or the other? I think it has to be both. You have to align incentives around your long-term value creation. And then you have to remind people of why it's so important and why it works.
Yeah, there's nothing like incentives, but incentives without this reminder, I think, is an important calling card for other companies that aspire to have a tighter connection and to maintain that over time. I can't wait to see what you and your team continue to do and how you continue to raise the bar across healthcare. Pharma in particular is obviously under lots of scrutiny, and I think we all need the creativity and ambition and commitment that Merck has brought to all of its work over all these years. So thank you so much for sharing your views on these, and we do look forward to following your work.
Thank you, Laura.